Hi, everyone, and welcome back to the Blue Veil Wellness Show. I'm Cristy Murray, Catholic nurse practitioner, and this is where we talk about faith, food, and function because real wellness means taking care of the whole person, body, mind, and spirit. If this is your first time here, I'm so glad you found us. And if you're a regular, welcome back. Pull up a chair. Today we are live, and that means I want to hear from you. So drop your name and where you're joining from in the chat. And if you have questions as we go, put it there, and I'll try my best to get to it before we wrap up. Today's conversation is something I've been looking forward to for a while. We're going to be talking about hormone monitoring, and you all know I'm a tech person. I like gadgets, and what it actually tells us, how it's being used in clinical practice, why it matters, whether you're trying to understand your cycle, navigate a diagnosis, or figure out what's happening in perimenopause, or if you're trying to get pregnant. So, but first, before we get into this conversation, I want to make sure you know about something coming up. I'm hosting a workshop called What No One Told Me About My Hormones. It's going to be a real practical deep dive into what's actually happening in your body. And there's also a chance to win a Mira hormone monitoring device. If that's something you've been curious about, this is your chance to try it. You can get on the wait list now, and I'm dropping the link in the show notes when we're done. So grab it before you leave today. So, our guest today is someone who is doing really important work in the intersection of hormone science and clinical education. Rose Mackenzie is the clinical manager at Mira. Mira is an at-home hormone monitoring platform where she helps healthcare providers understand and apply hormone data in real patient care. What makes her unique is she brings over a decade of experience as a certified fertility awareness instructor. She's trained in both the Marquette method and the symptothermal method. And she's worked with women across a wide range of situations, regular and irregular cycles, postpartum, amenorrhea, and chemo-induced menopause and perimenopause. And she just doesn't work with individual women. She equips clinicians and fertility awareness educators with the tools and confidence to actually interpret what hormone patterns are telling them. Because remember, it's all about patterns, not one value. I mean, it tells us something, but we always look for the pattern. And through webinars, case reports, and individualized support, she's helping providers move from guessing to knowing. So, Rose, I am really glad you're here, and welcome to the Blue Veil Wellness Show. Before we get into the substance, I'd love for you to introduce yourself in your own words. Tell us who you are, what you do, and what brought you to this work.
Yes, thank you for having me here. So I am a Catholic mom and practitioner. And as you mentioned, I've been working in this space for over 10 years. What drew me to this work is I love working with people. I'm a nurse by trade, and I really like helping people understand what their body is doing and how it can usually heal itself, or if you assist it. The body is really amazing. And when we start understanding what our body is doing, we really can take care of ourselves better. And so within women's health, I find this to be the utmost importance that we are body literate and we have the confidence to advocate for ourselves, understand what's going on, work with practitioners who respect us and respect our decisions. And so this is why I'm so passionate about women's health and using femtech as a tool to assist us.
I love that. We were talking about this before we started the show about how there's a lot of misinformation out there, and then whatever you find, you have to find a provider that's actually even remotely familiar with it to entertain what you had just learned about.
It's
Yeah, go ahead.
It can be difficult as the patient if you have concerns and then you say to your doctor, I have concerns about X, Y, and Z, and then you're dismissed. So I'm really trying to bring this to the forefront of the more providers understanding hormones, the more providers can take good care of their patients. So I like to think of it. I used to work in a practice that was NAPRO-FEM, and we cared for patients, and it was wonderful. But now I just think, in that practice, I helped hundreds, maybe thousands of patients. But now the ripple effect is even bigger. If I can help one provider who's helping the hundreds and thousands of patients, then it's a much bigger reach because they're having the tool that really helps them to do their best.
Yeah, I love that you worked in that practice. You consider yourself blessed to be exposed to that as a NAPRO trained provider. I just love how NAPRO has, certain protocols that we can, work with the creatine monitoring, and then there's protocols that that correspond to that. So we don't just have the data in front of us. We actually know what to do with the data.
Mhm.
And with a Mira device, from a patient standpoint, if you're advocating for yourself, talking to your provider, you actually have the data to bring with you.
Mhm.
It's like so you can have a good conversation and share decision making.
Yeah, I think really, I say Mira in the secular space really is a gateway to fertility awareness because women don't know what they're looking for. They're looking for answers and they start tracking their hormones. And then sometimes they discover things. They discover that they have a hormonal imbalance and then they go seeking for someone to help them or even they're looking to help themselves. They're like, oh, when I work too many night shifts in a row, then I see my hormones are worse. And so they're teaching themselves, like I can't overwork or I
Mhm.
need to, take better care of myself. I can't, not eat. I, ca-
Yes.
I, can, I can't expect my hormones to be optimal if I'm not taking care of myself. And so sometimes the data is just that kind of rude awakening to you, like,
Mhm.
you're not doing as good as you could be.
Yeah, because it's one thing, something telling you, right? Hey, do this and do that. But if it's your body actually
Mhm.
giving you that information, and it's
Yes.
different. Yeah.
And
So I
unfortunately,
have
we've been trained for so long to kind of ignore what our body is saying.
yes,
And so
yes.
this is really retraining us to start listening to our body.
So true, so true. So we have a long-standing tradition on this show. So three quick questions before we get into the good stuff. So what book are you reading right now?
Ooh, I'm reading the book called The Period Brain by Dr. Sarah Hill, which is so fitting,
Oh,
right? In my profession.
hmm.
So she's the author of her first book is Your Brain on Birth Control. And
Oh,
she really brings what we've known, right? That birth control is harmful to women, but she really brings it to the forefront in the secular world of we have been ignoring the science.
yeah.
And her first book was wonderful. Now I'm reading her second book called The Period Brain, which is all about the ignored fact that women are biphasic. We have a estrogen, I'll say dominant time approaching
Mhm.
ovulation, and then we have a progesterone dominant phase after we ovulate.
Yeah.
And if we ignore those two facts about ourselves, we really are not, again, caring for ourselves well, which leads us then to PMS and other symptoms that really disrupt our life because we have not been caring for ourselves in a way that our body needs.
Oh, I love that. I'm gonna have to add that to my
Mhm.
list.
Yes, I had the pleasure to doing a webinar with her last year,
Mhm.
and she just teaches things so well and
Mhm.
so relatable. She's funny and very intelligent. Her book, like when I'm reading her book, I hear her voice, now that I've presented with her. it's
Oh, okay.
she's done a really good job. So I haven't read the whole book yet, but it's been great so far. I'm like three-fourths of the way through it and
Okay.
excited to see the work that she's doing. I see that she's now presenting. She has been presenting widely, but now I see that she's was at the FACS conference that just happened and
Okay.
is educating the world the importance of women's hormones and your brain.
Oh, amazing, amazing. So what is the first thing that you do in the morning?
Well, honestly, I test my hormones, and that's not just a joke because I work at Mira. So I get up, I go to the bathroom, and I always joke with patients. I'm like, you have to go to the bathroom anyway. You might as well collect that urine, and then you can test your hormones. So that is my process. And you know, to be completely honest, some days I go to the bathroom, and then I'm like, oh, I was supposed to collect that urine. Oops.
Oh, I was in that. Yeah, yeah, I'm a Mira user myself, and then but now I'm Creighton, so it's like, okay, should I do Mira today or do the Creighton method today?
Mhm. Well, I
You
always
can do
tell
both.
people, I'm like, generally, um, NFP, fertility awareness, is forgiving. It just creates more abstinence if you forget something. So, if we miss, let's say, one data point of your hormones, you can pick it back
Mhm.
up the next day. Even if you miss, let's say, your LH surge is probably the most detrimental, right? If you miss your LH surge, it can be just a one day event. So that one's, of course, we'll say heartbreaking if you miss it. but you still have your other biomarkers you can track. So
Yeah.
you can still gather what just happened. So the way I describe it to my patients is I say, we really like to know when it happened, if possible. But if we don't, then we just make it a wider range. We say, well, it probably happened in these 3 days. And so then, again, it creates a larger fertile window and a little bit
Mhm.
more, we'll say uncertainty, but it's not like, I don't know, detrimental to you, your health.
Mhm.
It's not like you missed a very important medication that's
Yeah,
it's
yeah,
really bad if you miss a day. So,
that's true. That's true. Oh, I lost my. Okay, so next question is, what is your favorite food?
ooh, my mom would say I'm lying if I don't say ice cream because I grew up on a dairy farm, family-owned dairy farm, but I don't actually really like milk. I don't like it plain, I should say. But we always joke that I got my dairy from my ice cream, and my mom would always say, I would know if you were sick because if I offered you ice cream and you said you didn't want it, then she knew I was not feeling well.
Your mom knows you very well.
Mhm. And it's been, a long time since I obviously lived with my mom, but, it's still probably ice cream, so
I'm right there with you. Chocolate ice cream. All right, so let's get into it. So I think what draws a lot of women about this topic is that they've been told that their hormones are quote unquote normal. And
Mhm.
yet, they feel anything but normal. Or when they're charting their cycles and not sure how to connect the data to what's actually going on clinically. So Rose sits at that intersection. She understands the monitoring technology, the fertility awareness methodology, and the clinical workflow. So I'm genuinely excited to pull this apart today. So
Mhm.
because this is the kind of conversation that our audience and every woman actually needs to hear. So let's start at the top. So, can you give us a quick picture of what Mira does and why at home hormone monitoring matters for women right now?
Yeah, so if you're not familiar with what Mira is, I can quick show you. It's a standalone device, so it's femtech, right? A device. And then you're using individually packaged one-time use wands that you dip into a concentrated urine sample. When I say concentrated, what I mean is that we typically use after the longest period of sleep. So you wake up in the morning, you collect your pee. And we use that because two main reasons. One, most people don't eat and drink while they sleep, so it's naturally concentrating. And we go to the bathroom less often. So during the day, we're eating and drinking, we go to the bathroom. Most of us don't time when we go to the bathroom. So this is again a way to collect a naturally concentrated sample. And the second reason is it fits into a routine. As I was joking, most mornings I wake up, I pee into my cup, but you don't actually have to test every day. So sometimes I've been in a phase where I don't have to test, and then I'm supposed to start testing again, and then I forget. So, but how do you test? You get a device, you get wands, you collect your urine sample, and then you simply dip the tester for 20 seconds. You cap it, you put it into your machine, and then the machine does the work of reading it. So it's a generally one time a day morning exercise. So if you're testing or tracking, let's say cervical mucus, that would be then throughout the day, and your assessment is at the end of the day. So those two things can complement each other very well. Two different ways to track the same thing. So a rising estrogen, you can measure in urine, or you can measure your changing mucus pattern. And so it's kind of two ways of looking at, again, the same thing, and they generally complement each other well. And they can show us, for example, maybe you have suspicions that your estrogen's not behaving correctly because your mucus pattern isn't making sense. Then you can actually see the pattern of your hormones. So, again, very, if you're visual, a data kind of person, or you want to then go and show it to a provider, even if your provider isn't, let's say, trained in NAPRO or RRM or neofertility, they understand what hormones do. And so if you show them something and all your estrogen, let's say, is flatlining, that means something to them. So it can really make that conversation you have with your provider easier because you say, I'm concerned I have low estrogen because, and then you can fill it in. My mucus pattern's not making sense. My Mira data shows that my estrogen is low. And maybe you have another symptom associated with it. So it makes that conversation easier with your provider.
Yeah, so like my story is I'm on patches and the utility for Mira for me is, one time I like switched locations where I
Mm.
put the patch. And then I was looking at my device and then like my estrogen dipped. I was like, okay, what is happening?
Mhm.
So
You're like,
thankfully, yep,
something changed, and I
exactly.
know what it was.
Thankfully, I was monitoring my pattern, and what that told me is that whatever the location that I changed, putting my patch to was not an area that's enabling me to absorb the medication
Sure,
very well.
sure.
So that alone is very valuable. Otherwise, if I didn't have
Mhm.
that, I would just, troubleshoot for a long time.
Yeah, we've also seen, we're going down a rabbit hole here, but, we know everyone does not absorb their estrogen the same. And so some women, do absorb patches, but other women don't tend to absorb them well. And so you can trial and error for a while on patches and not feel better.
Mhm.
But if you're doing mirror testing, it really helps you in 2 ways. If you, let's say, are perimenopausal or, post-menopause and you're using estrogen therapy, we actually advocate for a threefold measuring, we'll say. 1, we wanna see that your symptoms improve. 2, we wanna see there's evidence of absorption, which on Mira would be E3G rising. And then 3, we wanna see, is it changing your FSH? Because, now again, we're going down a rabbit hole here, but FSH is kind of, I'll say, been ignored for too long. FSH is another biomarker that can be tracked, and we know it goes up obviously in perimenopause into menopause, but not everyone's goes up the same. Some people have a much higher trajectory. And what we're finding is there's risk factors with high FSH, and that's independent of estradiol. And so, just like we don't want to ignore someone who has, let's say, high blood sugar or high blood pressure or abnormal cortisol, or abnormal cholesterol. We don't want to simply ignore someone who has elevated FSH. If you don't want to intervene and change your FSH, at least know what yours is, because that may be helpful down the road. So we're seeing, for example, um, FSH is related to cardiovascular, neurological, bone health, and fracture risk. And some of the newer spaces is even with, like tumor growth and cancer risk. So it's very exciting. It's cutting edge research that's coming out. But what I love about it is Mira helps you. You can track your FSH very easily, if nothing else, for information gathering, even if you don't plan to intervene or change anything about it at the moment.
Yeah, because like these hormones, they fluctuate like wildly, especially in perimenopause. So it might be high one day, and then like a few hours later, if you test again, I mean, not that you have to change several times or check several times a day, but it does fluctuate. But the thing is, if it's consistently elevated, then that's, a red flag.
Yeah, so there's really 2 time frames for FSH that's kind of starting to emerge: chronically elevated and rapidly increasing FSH, and both kind of can carry risk. So, I'll give an
Mm.
example of someone who had that rapidly increasing. So we had it actually was a provider herself who was, she ended up donating her kidney to her sister. She was
Mhm.
46. She had had regular cycles. Earlier in her 40s, she did have some cycle changes, like shortening of her cycles, and she did the work to support her hormones because she wanted, optimal hormones as long as she could. So at the point that she had surgery, her hormones were balanced and she had regular cycles. She donates her kidney to her sister, and she went into immediate menopause, like no
Oh,
cycles for months. She had very high FSH, low estrogen. And, we've written this up as a case report because the provider said, she is the provider, but in this case, the patient. And she said, um, my surgeon was like, well, this is just coincidence. And she's like, no, it's not. My hormones are definitely responding to,
mhm.
this abrupt situation change. And so she went digging and, she got her surgery report. And um, mm, from my understanding, I'm not a transplant specialist here. They usually take your right kidney. But in her case, because of her anatomy, they had to take her left.
Okay.
And when you take a left kidney, they have to clamp off the blood flow to your ovary as well, to,
Oh,
to
okay.
your adrenals and your ovaries. So it's kind of a double whammy there. And so she really believes that that kind of, we'll say, shock to the system really sent
Mhm.
her into menopause. And she got fed up getting her blood drawn over and over again to try to see, like, am I making any progress? My FSH is high, my estrogen is low. Am I making any progress to get any recovery from this? And so that's how she found Mira. She's like, I need to be able to test this at home easily. I'm sick of going to the lab and getting my blood drawn. And then
Mhm.
what's really fun is we actually got to capture her returning of her ovary.
Oh,
So
wow.
she was, we kind of joke she was reviving her ovary, which she did, a bunch of work to do that. She did go on temporary hormones. Um, but while she's on hormones, Mira could show, yes, she's on hormones, but the return of her own ovary will go above and beyond what a patch would do, for example. So we could see, yes, she's on a patch. And then all of a sudden you see this rapidly increasing estrogen. And we're like, that's it. Your ovary's back.
It's alive.
And she watches her FSH come down. Then she could stop the estrogen therapy. And then she got to move back to timed progesterone therapy. So cyclical progesterone instead of just generically every day.
Mhm.
But she's like, my ovary's coming back. I have return of hormones. And again, without femtech, without technology like Mira, you might have, I'll say, like a fuzzy sense, but once you have Mira, it really makes clarity. And I'll be very clear here. Clarity does not always mean that the hormones are perfect and they make sense, but you see clarity on what they're doing.
Yeah.
And so then you can see, okay, my hormones are abnormal. What I suspected is true. Or I thought it was this hormone misbehaving, and actually it's all three. Or, it really it provides that clarity and helps you to decide what am I going to do next? Am I going to, do a bunch of interventions myself, lifestyle,
Mhm.
diet, or I always tell people maybe you were kind of doing all the right things, and now like it's time for the next step.
Mhm.
And it's not your fault, like, you're trying your hardest with eating really well and sleeping, but maybe you still need a little more. And now like, you can stop blaming yourself. Like, you have done everything you can. It's
Mhm.
time to move on and get some more support.
Yeah, it's that data. I love that story that you can tell the return of like the ovaries coming back alive. For
And of course, that's a very unique situation, but
uh-huh.
I like to in perimenopause, you mentioned that hormones fluctuate a lot, and that's true, but I also want people to know, like, they don't fluctuate so much that there's just no point in testing them either. Like, there's actually very obvious patterns that I love watching, like, when I'm a data nerd and I just love what the hormones tell us. But sometimes people
Mhm.
are like, "Well, I'm just not gonna test my hormones because they're not gonna make any sense anyway, and I'm not gonna be able to do anything about it." And so I wanna, if it's okay, I'll show another chart example. This is side by side 50-year-old women.
I
And
just
so
before you go on, I just wanted to tell people what FSH is. If you don't know what
Oh,
FSH is, it's follicle stimulating hormone. And the way I explain it to people is that your brain is telling your ovaries, hey, go ahead and stimulate those follicles, and then the follicles in turn give us the estrogen that our body needs.
mhm. And the example I like to give in relation to what I was just talking about is think about your ovary like a glass ketchup bottle, and the brain is you tapping the back trying to get your ovary to make some estrogen still. And sometimes in perimenopause, you don't get that little glob of ketchup like you wanted. Sometimes, like a glass ketchup bottle, all of a sudden it goes split and you get this whole mountain of estrogen. You're like, that's not what I was hoping for. That's not what the brain was trying to do. But
Mhm.
in perimenopause, we start losing some of this coordination everything doesn't always make sense anymore.
Mhm.
But again, with that, you can actually see how the physiology, like your body was trying to compensate and it overcompensated in some sense. So it does actually start to make a lot of sense. So yeah, thank you for bringing up FSH. I forget FSH is not always well known because it's not one of, I'll say, the primary hormones that we track.
Mhm.
Most people are aware of estrogen, LH, progesterone, but FSH is definitely a big piece of that. And there's plenty of other hormones
Yes.
that we don't test that still, of course, have involvement in this process. But Mira can test all four of those. So estrogen, LH, progesterone, FSH. Mhm. Okay, are we ready for this graph?
Yes, we are.
Two charts. Okay, so we have side by side women. So again, kind of the intro to this slide is um, the hormones sometimes don't make sense, but sometimes they do. And without testing, we don't know which camp we're in. So we have two women side by side. They're both 50. Let's say they both say, my cycles are irregular at this point. I don't know when they're going to come. But the hormone patterns that they each have are distinctly different. So let me see if you can, I'm not sure if you can see my cursor very well, but these black lines are rising estrogen here. So we have this spike, right, of rising estrogen. And then we get the trigger of LH, which as a reminder is your brain telling your ovary to release the ripe egg. And in this case, the ovary responded. And we release the egg and the progesterone goes up, but it's low, which is, I'm not surprised at 50. Sometimes we get good progesterone, sometimes we don't. And so this one, it's low progesterone. So if I looked at this hormone pattern, I would say what I'm concerned about is low progesterone. She still has coordination, she's still ovulating. So how I would look at this woman and what I would do to support her and what interventions we might do would be completely different than the patient on the right who
Mhm.
has only estrogen. She has no LH surge. She has no progesterone because it's an anovulatory cycle. So one patient, low progesterone, one patient, no progesterone. And so the approach to these women are going to likely be distinctly different. And you as the user can have way more understanding of yourself if you're like, oh, that's why
Mhm.
I've been maybe more irritable or I had a heavier period because you had the estrogen changes, but you didn't get any progesterone to do the next part of the process. So again, I always joke that I speak hormone and I speak in graph. So I just love this data and how much it really can support women.
Mhm. Yeah, and just to be clear, it's data, it's information that our body is telling
Mhm.
us. It's not a diagnosis, it's not a tool for
No.
diagnosis. It's
Nope.
evidence, that we can
Mhm.
bring forth because like Rose had mentioned earlier, there's more than just the three hormones. There's it's a
Oh, yes.
symphony and everything, every one of those hormones have to be in balance with each other.
Mhm.
That's why it's tricky. And we
It's
should
just
tend
like
to
if you
focus on
had,
one.
let's say, spotting. The spotting is pointing to something that's happening as well.
Mhm.
And so now you just have more data to back you up. So when you say, I think something's off because I get spotting before my period, my Mira shows low progesterone, and let's add in I have difficulty sleeping after I
Mhm.
ovulate. So all these things are pointing to something, and that can really help you to in two ways. One, understand yourself. So you start putting things together. Oh, I get this symptom when this hormone pattern. Or it can be the opposite too. This symptom has nothing to do with these four hormones because there's no rhyme or reason to it. So
Mhm.
now you can kind of, we'll say, rule out. So I don't get this symptom for, let's say, high estrogen or low progesterone. This is something else. Maybe it's my cortisol.
Yes.
Maybe it's overall, it's an issue with my thyroid, or, it's, I'm nutrient depleted. There's a lot of things that
Yes.
can cause symptoms. And so, we can't blame everything on our hormones, but there definitely are
Mhm.
some things that we really should pay attention to. Our hormones are telling us something.
Yes, exactly. It's a signal. It's not, like, hey, fix this and everything else will be okay. Like
Mhm.
I always get asked, like, so if you put me on estrogen patches, am I going to lose the weight?
Oh, I wish it was so simple. I wish it was
Right?
always 1 plus 1 equals 2. I
Yeah.
wish.
And here
I
I'm
I
like,
always I also have people that say, like, "From the data, can you tell me if I have endometriosis or PCOS?" And I'm like, "I wish it was that simple," but there's not, like, a one clear pattern that says you have
Mhm.
this problem,
Yeah.
because hormones are, um, over like, they're the center of everything. They influence so many things and so many things influence them. I like to think of it like
Mhm.
an old-fashioned wagon wheel. Like hormones are in the middle of the wagon wheel, and then we have all this spokes. And the hormones matter for everything, and everything matters to the hormones.
Mhm.
Um, but it's not like one thing is on its own in this little island. There's not silos. They're all
Yes.
interconnected. And so the way I explain it is if you want that wagon wheel to go around well and you want, smooth sailing, or I
Mhm.
should say, even road, you have to fix all the things. So you can't just ignore if you have high insulin. You can't ignore if you have
Yes.
underactive thyroid. You have to fix everything. And I
Mhm.
love that that's what your show is about. It's not only physical as well. Like
Yeah.
you have to think about the whole person. And when you heal and support the whole person, then your body can do what it's meant to do, which is at in reproductive years, your body is always trying to ovulate. It's always trying to get you to, I love actually in the book, the period brain.
Mm-hmm.
She says your body has two phases and it's biphasic, right? One half is it's all about conception, trying to get you to find a mate, be intimate with that mate and have a baby, right? That's first half. And then your body switches to, well, if you did conceive, now you have to prepare for that baby. So it's all about preparing for implantation and pregnancy. And so we flip between the two sides, trying to
Mm-hmm.
conceive, and now we're trying to sustain a pregnancy. And
Yes.
whether we're trying to or not, right? This is anybody from puberty to menopause. That's what our body is trying to do every cycle over and over again. And if we fight that, ignore it, resist it, we're just going to be unhappy, unhealthy, and grumpy.
I love that you just like lay that out. Hey, this is what it is, and this is what's gonna happen. Yeah.
Mhm.
So like speaking of charting and like PCOS, so yes, endometriosis, we can't see it on like, hormone levels
Mhm.
and charting. But creating charting though, we're able to pick up, okay, when there's certain charts that we can identify that, oh, this woman has PCOS and that's what's happening.
Yeah,
Um,
I would say it really is a skill that
mhm.
certain providers have that they pick up on things that will be completely missed by other providers. And it's not a fault of their own. Like your OBGYN will not be able to say, I suspect you have endometriosis, likely. But your NAPRO, your neo fertility, your RRM, even the providers that so I train providers of all type, general OBGYNs, functional medicine, acupuncturists, health coaches, personal trainers, anybody that wants to know what their patients and clients' hormones are doing, that's who I train. And there are a lot more providers who want to take really good care of you than you realize.
Yeah.
They're just harder to find. And that's just the truth. Um, but when you find a good one, you'll know because they listen. They will keep looking for that needle in the haystack. Like it's not, we'll try one thing. If it doesn't work, then offer you birth control kind of scenario. Or I should say, they just offer the birth control, don't even test anything. Because we all know that happens a lot. And again, that's just, unfortunately, that's how those providers are trained. And I worked in conventional medicine. I was an ER nurse for 12 years. And so I know that system. And it really takes providers who are going to go against, we'll say, go against the grain here a little bit and step outside the box and say, we can do something better for women. And so those providers, based on your symptoms, your hormone data, and what you're saying to them, they'll be like, I'm concerned you have endometriosis. And the provider I used to work at, I worked with her for about 2.5 years, but she had practiced 11 years by the time, at the end of my 2.5 years. And all the times that she suspected someone had endometriosis, and then they went and had their laparoscopic surgery, only one time did the patient have laparoscopic surgery to see if they had endo, and they did not have it.
Mhm.
All the other times, she was right. So find the provider who is a good fit for you. And again, if they suspect something that a provider has never said to you before, that doesn't mean they're wrong. You might have to settle into that shocking news. I can imagine multiple times where we tell the patient we think you have endometriosis and it's kind of crushing to them. But instead, I like to think of it as an opportunity. You have an opportunity to potentially solve the mystery. And it's not I don't want this to sound harsh, but it's not a label or a negative on you if you get diagnosed with PCOS or endometriosis or any of these things that you think like it's devastating. Instead, think of it as, this is my opportunity to care for myself better. What can I do to help be a solution? You know, not saying it's your fault that you have it. Some things are genetic and out of your
Mhm.
control, but now you can be a part of the solution, even if you weren't a part of the, let's say, problem to begin with.
Yeah, I totally agree. Like finding a diagnosis is something like it's an opportunity, and so now we know how to move forward. We're not stuck in the world of I wonder what's happening, let's try this
Yeah.
and that. So now we have direction. And yeah, so like you had mentioned earlier that like if your provider tells you something, so I check fasting insulin a lot,
Mhm.
and then found out that not everyone checks it. So when I give that diagnosis of insulin resistance, and
Mhm.
I say, this is why we came up with this diagnosis, these are your levels, some people will actually like be taken aback, like, no, that's not true. Like I've
Yeah,
always I've always been fine. My A1C is
yeah,
always normal. So then, like we go into this our education that
yes,
fasting insulin and A1C are two different things.
yes, yes,
So then, give them the data. But yeah, so when like you're given a diagnosis, then you can't believe what it is. It's a good opportunity to have that conversation with the provider who told you, like, how did you come up with that? And then so
mhm,
like why? And I do hear a lot of my patients when I tell them that, it like something clicks in their brain and they get affirmed, like, okay, I knew something was wrong. I'm glad you checked it. Now we can
mhm.
move forward. Now what do I do?
Yeah, yeah, so just anytime you get news, I think this is just my piece of advice across the board.
Mhm.
Anytime you hear something or you get news that kind of just, like, hits you and you're like, "I feel uncomfortable," or "That makes me angry," or whatever, like, process through that. Figure out why, because it's likely something you experienced in the past or it caught you off guard, and like, work through that, and maybe you aren't ready to ask, like, that clarifying question to the provider right now, but start writing down notes, like, questions that you have, and then next time you come around, you can ask, because the worst thing you can do is just ignore it and say, "It didn't happen,"
Yes.
and, because then you're just gonna have to process it later anyway, and so you might as well lean into that uncomfortable situation. And again, this can be pretty much everything in life. Lean into the uncomfortable situation and, learn from it, write down some questions, seek out good counsel. And so I've had the same experience, like when I tell someone, I look at their data and I say, "I'm concerned you're not ovulating." And, that can be kind of crushing to someone to think that they've been trying to conceive for, let's say, a year, and then they find out that they're not actually ovulating and no one's told them. And, they can feel, very frustrated with maybe the workup they got done in the past, or frustrated that they wasted a year, like the emotions can be really high. But then when you start like processing that, it's kind of like grief, right? We all process grief. Like when you go through the process, you actually end up better in the end. And so I give this analogy when I'm talking to couples, like, you're going to go through something hard in your marriage. You don't know what it is, but it's going to happen at some point.
Mhm.
And don't let whatever it is, whether that be fertility awareness or that be a financial hardship or whatever comes your way, don't let that be a wedge. Instead, let that be something that actually builds the two of you together and cements the two of you even closer together so you come out stronger in the other end. So, hard situations are not necessarily bad. Of course, we don't like them, but they can be, a very growing experience. And afterwards, you look back and you're like, I don't want to do that again, but I'm glad I've learned what I learned from
Yes.
it.
Yes. So that's a good segue. I feel like we're, going into the faith and stewardship angle now.
Yes.
So it does come a lot, in my work. And a lot of women in this community choose fertility awareness methods for reasons that, go beyond just tracking. So
Mhm.
it's part of how they understand their bodies and their vocation.
Yes.
So how do you see hormone monitoring supporting that approach? Especially, like you're trained in Marquette, I'm trained in Creighton and Napro, and then there's a lot of methods out there.
Yeah. So the no matter what method of NFP you choose, it's a fertility awareness method, right? You're becoming aware of your fertility. And then you get to decide what you want to do with that information. But I always tell people, like, they'll ask me, should I do Marquette? Should I do Creighton? Should I do, Fem? What should I learn? And I'm like, all the methods have pros and cons. You want to find one that fits you and your lifestyle, because I can tell you this method, is 98% effective and it's low cost. And, I can give you all these positives. But if you say to me, like in the Marquette world, if you say to me, I'm grossed out by collecting my urine and dipping a test strip in it, well, then it's not going to work for you. And
Mhm.
that's not a good fit for you. And so that's actually why I love all the different methods. We actually support each other, because if someone comes to me and they say, I want to track mucus only, I'm like, that's great. But I'm not going to be your instructor then, because that's not what my specialty is. If you want to track mucus only, please go learn Creighton or Billings, the methods that are mucus only.
Mhm.
And so we really can, this is not a competition between the methods. This really is, we all can encompass and help all women when we use our strength to help the right women.
Mhm.
And the users, um, I've had users that use 4 methods throughout their reproductive lifespan. and and they chose the method that fit their certain situation. And that's what worked great for them. And I'm like, that's wonderful. Like, that's what you needed. I'm glad there was an instructor that could support you, and got the outcome that you needed out of that. Um, so from my standpoint, this is actually, I think, uh, I apologize for my analogy here, but I think of it like the universal church. All the methods are all seeking what's good for you and to support you. And there's different kind of, I'll call it flavors, different methods, but
Mhm.
all of them are trying to teach you that your body matters, and how you treat your body matters, and you should take care of yourself well, and helping you understand what your body's saying. Like, that's really the foundation for me.
Yeah, and then like it is holistic too, because it respects your marriage, it respects you as a person, and like all these methods that we had talked about, it's not like, okay, show up with, $20,000 and we'll help you get pregnant, right?
Right.
Like there's no promise of, and like, don't even get me started on the unethical issues that
Yeah.
that go
We can have a
beyond.
whole nother episode on that.
Yes, yes, we can. We do. I just want to say, because I do have someone, is looking for creating a NAPRO, and um made an appointment with me through telemed, and she said she was told that her only option was IVF because she's not ovulating, or she's ovulating, but the eggs are not good quality. So
Hmm.
she was just told, hey, your only option is IVF. And then so my question to her was, so what can IVF help you produce a healthy egg? Or how are they
Hmm.
gonna, so anyway,
Well,
so we're both like, and she said, yeah, exactly, that's why I looked for you.
yeah. Yeah. I will say, in my line of work, what I love is the providers that I help um, always want optimal hormones when possible. And we will, of course, intervene in ways that we can, but we're in cooperation with supporting the body. And that's, again, like, that's what I love, is a woman's body was made good, and a woman's body was made to be loved and respected. And NFP and fertility awareness are a piece of that puzzle. And I think that the the world in general is inching closer to that realization from femtech. And I love it sometimes when I see, so I'll give an example of, we had so with Mira, if you're a provider, we want you to trial a sample so you see what it's like and how you can use it in your practice. And so we had a provider trialing it, and she said, well, I don't need to trial it. I have an IUD. And I said, well, actually, um, because you actually don't know what your hormones are doing with the IUD in place. And to her surprise, she still was ovulating with her IUD in place, and she's
Really?
shocked. She's like, how am I not getting pregnant? And I said, well, an IUD works in multiple ways. And
Yes.
so it's still thinning your lining, but your ovary is still producing the hormones.
Hmm.
And so it was kind of an eye-opening experience for her. And this provider was a nutritionist, and so she said, I have many patients who have IUDs in. And now I can't just assume that they all have low hormones. And I said, correct.
Mhm.
The basic question that I always challenge the providers I work with is, do you know if your patient's ovulating? And a lot of them will say, well, I know they're not because they have an IUD. And I'm like, no, that does not answer the question. Or
Right.
they'll say they're having a period. And I said, no, that doesn't answer the question either.
Yep.
Are they ovulating? And many of them don't know. And so I am kind of challenging their thinking of what's optimal, what's normal. Ovulation is what's optimal, what's normal, not the
Mhm.
bleed. Because as we know, if
Yeah.
someone's on, let's say, an oral birth control, they get bleeding,
But it's
but they're
withdrawal
not
hormone.
ovulating, it's withdrawal, right? And so
Exactly.
that's also, so I think, again, I see these little slivers of hope that, like the book, the Period Brain, is really educating women. And I see, women starting to realize that birth control might not be what's best for them. And so they're trying to find other means. And so I do see this kind of tide turning where women are demanding better care, which is super exciting. I wish it would have come many years ago, but it is super exciting to see. We have, just to give some examples, on the Mira platform, the Mira app. Of course, it wasn't initially intended for those trying to conceive, but we see that for over 40% of the users in the app are not using it to conceive. So they're using it for perimenopause, hormone imbalances, monitoring for health reasons, trying to avoid a pregnancy. And I have to be very clear here, as the clinical manager at Mira, Mira is not an NFP method. Mira is a tool to
Yep.
use with an NFP method if you're trying to avoid a pregnancy, or it can be used as a tool to help you in your medical care. But in and of itself, it's not a diagnostic tool and it is not an NFP method. So just so we are very clear there, I don't want someone writing into you saying, I used Mira and I got pregnant and I didn't intend to.
Yeah.
Because my follow-up question would be, did you learn a method and did you have an instructor?
Mhm.
So,
Yes. It's important. I gave a presentation about creating a NAPRO somewhere, and someone said, "Oh, I can just get the materials and do this on my own. I don't need an instructor." And I was like, "No, not really. You need someone to help you
yeah,
monitor and help you do it correctly as
yeah.
with your intended use."
Mhm, mhm.
Yeah.
This is and, and again, I do think Mira is a tool or a gateway to people moving into more of a fertility and awareness space because they get the tool, they start using it to, let's say, get pregnant, and they're like, "Oh, this is pretty cool. I can see what all my hormones are doing." And then they're now postpartum, and I can tell you that we get a lot of questions into our customer support. "Can I use this while I'm postpartum and breastfeeding?" And we're like, "Yes, you can, but
Yes.
you need to work with an instructor if you're trying to avoid a pregnancy."
Mhm. Yep. Totally agree. Well, Rose, this has been such a genuinely useful conversation. And I think what I appreciate most is that you're making this feel accessible, and hormone monitoring doesn't have to be something that only certain women get to use. So it's
Mhm.
a tool, and in the right hands can bring real clarity. So for anyone in the audience who wants to learn more about what Rose does and what Mira offers, you can find her on Instagram at Hello Mira Care, on LinkedIn. I'll drop all these links in the description. And also, Rose is on My Catholic Doctor as well if you want to work with her in a different capacity. I'm on My Catholic Doctor. We have wonderful providers there that can, work with you holistically, and hopefully you find someone, within your state and what you need. So
Mhm.
Rose, thank you so much for being here. This is exactly the conversation that this community needs. So friends, if today's conversation gave you something to think about, a question to bring to your next appointment, or just a sense that there are people in your corner helping
Mhm.
you understand your body, this is exactly why we do this. And if this conversation sparks something for you, if you're sitting there thinking, I want to actually understand what my hormones are doing, then I want you to join me in my upcoming workshop, What No One Told Me About My Hormones. We're going deep on exactly what your hormones are doing and why it matters. You'll also have a chance to win a Mira hormone monitoring device, the technology we had just talked about. I'm
Mhm.
building the wait list right now. The link will be on the description. If you're not already subscribed to the Blue Veil Wellness Show, please do that right now. And if you share this episode with a woman who's been asking questions about her hormones, hey, you'll be her best friend. She needs to hear this. As always, caring for your body is stewardship. It honors the one who made you. And when you understand what your body is doing and why, you show up differently for your family, for your vocation and for yourself. I'll see you in the next episode. And until then, stay rooted in faith, intentional with your food, and aligned with your function.